Over the past 2 weeks, staff across Ballarat Health Services and Ballarat Aged Care have been working to contain an outbreak of COVID-19 in one of our aged care homes. This outbreak has been contained, and while there has been a total of 5 cases related to the outbreak, there has been no further transmissions since the first case was identified 2 weeks ago. I would like to extend my sincere thanks to all staff across Ballarat Health Services for supporting aged care and subacute care through a swift and professional response to prevent and control the spread of the infection. With the final clearances of COVID-19 test results of staff and residents who were found to be close contacts of positive cases, Bill Crawford Lodge will return to normal operations over the next couple of days. We have received a lot of questions about why this outbreak is different to outbreaks in private aged care facilities. And this is because Ballarat Aged Care, as part of Ballarat Health Services, benefits from the highest level of access to and oversight from clinical expertise. The care provided in our homes is overseen by registered nurses, and as a public aged care provider, we adhere to the higher staffing ratios. In addition to residents having access to registered nurses, we also have access to highly experienced clinicians in infection prevention and control measures. In response to this outbreak, we implemented in our residential pandemic plan, we notified the Department of Health and Human Services of the outbreak and adhered to directions from the Chief Health Officer's office. We implemented COVID-19 restrictions on people coming into and out of the sites until the facilities are going to be cleared by the infectious disease specialists. We worked closely to isolate positive and symptomatic residents, and we undertook deep cleans and ensured staff have access to and were correctly using personal protective equipment. And we're extra vigilant with hand hygiene. In addition to these things, the 2 affected residents were transferred to the Ballarat Base Hospital in order to provide the clinical care needed. We have been continually monitoring symptoms and testing all residents and staff within the home and removing symptomatic staff from the facility and providing them with the necessary supports required. Importantly, we suspended all contract services to all our facilities. While the impacted home will return to normal operations over the coming days, visitor restrictions remain in place while we continue to protect our residents. Ballarat Health Service is proud to be providing professional quality aged care to Ballarat and the Grampians region for over 150 years. We are sharing this expertise with private and public aged care providers in the region. We're collaborating with groups to ensure that our region has the best clinical support and infection prevention measures to protect those who are most vulnerable in our community. I thank you all for your support and understanding over the past weeks. I'm overwhelmed by the positive messages coming through to our teams. I thank you.